Welcome to Doordarshan Kendra Kohima. We are here today from the Nagaland State Legal Services Authority to discuss one of the health schemes of the Government of India under Health and Family Welfare Department, which is Ayushman Bharat PMJAY. Before we go into the discussion, let me introduce the panelists for today. First, we have Ms. Kezosano Kiki, advocate, working for Nagaland State Legal Services as a project coordinator, and Imli Kala Jamir, also working for Nagaland State Legal Services as a project coordinator. Now we shall discuss the scheme.
Thank you for having us here all today. We are privileged and we are also hopeful that this discussion will be productive and meaningful for all the viewers, listeners and everybody present here.
So Kiki, can you also please tell us what this scheme is all about?
So Ayushman Bharat is a flagship scheme of the Government of India, which has been envisioned to achieve universal health coverage for the entire populace across the country. And this scheme was launched on 23rd September 2018.
Okay. So what are the benefits, some of the benefits under this scheme?
The scheme has various benefits and catenas of benefits enlisted under it. I'll just read it out so that everyone can have a clear understanding on what the benefits are under this scheme. So first and foremost, we have the medical examination, treatment and consultation, then pre-hospitalization up to 3 days. Then there are medicines and medical consumables, which will be in the form of cotton, bandages, gloves, all the small necessities which are required in terms of treatment. Then we have non-intensive and intensive care services. We have the diagnostic and laboratory investigations as well. Furthermore, they also have the medical implantation services, but this services is available on as and when it is required and is necessary. Then the scheme also has a provision for accommodation, food services. Then certain times it could also be the case that when a patient is undergoing certain treatment, they could succumb to certain complication. So the scheme also covers such complication arising in course of the treatment. Furthermore, certain times the patient will also need follow-up care, post-hospitalization care, so on and so forth. So the scheme also has benefit for post-hospitalization and follow-up care up to a period of 15 days.
Okay, thank you. So Imli Kala, like they say, the scheme came into being only in 2018, but then there are people with pre-existing diseases. So will the scheme cover those diseases for those people?
Yes, definitely. Pre-existing diseases are also covered under the scheme.
Okay, thank you. So Ms. Kiki, can you also tell us who are eligible for the scheme?
Eligibility criteria under the scheme is divided into two parts. The first part would be the people who are enrolled under the socio-economic and caste census of 2011 database. So if your name is reflected in the SECC 2011 database, you will be eligible under the scheme. The other class of people who will be eligible are the ones who have formally registered themselves under RSBY scheme. So RSBY scheme was prior to PMJY existing health scheme, but after PMJY came into being, RSBY has been done away with and PMJY is now the health scheme that is in place. So all the beneficiaries who were earlier enlisted under RSBY scheme will also be eligible under the scheme criteria.
So like Kezo has said, Imli, it is said that if your name is enlisted or enlisted under SECC of 2001, only then you will be eligible. So how can someone know if you're eligible?
Eligibility can be confirmed by visiting the nearest impaneled Common Service Center or PMJOY impaneled public or private hospital.
So you say Common Service Center, but not many people are aware of what this Common Service Center is. So can you please tell us what the Common Service Center and how to find this Common Service Center within our nearest vicinity?
Common Service Center is an access point to deliver all the public utility services like healthcare service. And to know the address of the nearest CSC, one can contact the contact number. I'll just read it out. It's 14555, or you can also contact 1800-111-565. The numbers will also be displayed on the screen.
Thank you. So Kezo-sano, this question is for you. If one member of a family is a beneficiary under this PMJAY scheme, but the other members are not listed. Is it possible for the other members of the family to also avail the scheme?
So the good thing about this scheme is definitely yes, if there is a beneficiary who is already existing verified beneficiary, which means his name has been reflected in the SECC 2011 database. He has applied for the scheme and now he is a potential beneficiary. So that will be already existing verified beneficiary. So if in one family they have an already existing verified beneficiary and one of the family member wants to be added as a beneficiary under this already existing verified beneficiary, then definitely yes, he or she can also be enlisted as a beneficiary. But for having to prove the relationship, they should also show a valid proof of document like ID to establish the relationship between the beneficiary and the one who wants to be added under that already verified existing beneficiary. The proof of document is required for that.
Okay, thank you. So what is the procedure for enrollment under the scheme?
So under the scheme, there is no specified procedure per se so far, but the only criteria is that, as priorly discussed, if your name is reflected under the socio-economic and caste census of 2011 database, and those who are already registered under RSBY, those are the ones who will be eligible and can enroll under the scheme. As such procedure, there is no specified procedure so far.
Okay, so Imli, what is the validity of this scheme? Is there any time period for the scheme?
Well, the scheme does not have a specific time period or validity, but once if an individual is eligible for the scheme, then he or she can avail the scheme.
Is there any age limit or limit on family size to avail the scheme?
If a family is covered under socioeconomic caste census database, then all the family members will be covered under the scheme irrespective of family strength, age or gender.
So can I also avail the benefit of the scheme if my name is there on the list?
Yes, definitely benefits can be availed, but for that purpose an e-card will be issued.
Okay, so you say an e-card, so Imli, can you also please elaborate and tell us what an e-card is and what is the purpose of an e-card?
Well, e-card can be used to avail the services under PMJAY across the country, irrespective of all the states.
Okay, Kezo, can you also tell us who issues this e-card and then what are the steps and procedures for attaining this e-card?
The e-card is issued by various process. I'll just explain it. So what can be done is the beneficiary will have to visit the nearest empaneled common service center or visit the empaneled PMJAY private public hospital, and while visiting they should carry a valid government approved ID card. It could be an Aadhaar card, it could be a PAN card, it could be your ration card, whatever government approved card, voter ID card which has been approved by the government. So you have to carry those documents and visit the empaneled CAC center or the empaneled PMJAY public private hospital. That is one way. And the next way is where the healthcare providers come door to doorstep to collect these documents from you. So you can also get your e-card done from the healthcare providers, where they will come and collect the documents from your doorstep. And after they collect all these documents, one is whether you visit the common service center or when the healthcare provider comes and you give a valid document, then after that online authentication will be done regarding the proof of documents that you have given. And while online authentication is being done, you'll have to provide a mobile number. So if you don't have a mobile number of your own, you can also give your friend's mobile number or a person whom you know, or a verified person's mobile number. You can give his or her mobile number as well. And then in case if you don't have any other government valid ID, or if you don't have Aadhaar at all, then your photo will also be taken, because you need to have your photo ID proof as well, right? So your photo will be taken in absence of an Aadhaar card. And after this online authentication and giving of your mobile numbers, your record will be sent for approval to, and then after record is sent for approval, acknowledgement slip will be given to you. And it's important that you keep this acknowledgement slip, because then you have a proof to show that, you know, I've gone through this procedure. And after the records are matched, it will be approved and you will get an information through SMS. So when they're saying records are matched, means your if your name is under SECC database 2011 and then you give your government valid ID proof. So those records and data they'll have to cross-check and verify. And when those records are being matched, then you will get a confirmation text through SMS. And after that, the approved beneficiary, after records are matched, approved beneficiary name will be inserted as verified under PMJY database, which means now your records are matching and now you are verified under PMJY. And after that, the approved beneficiary are assigned a special unique ID number. So that will be your ABPMJY ID number. So that ID number, you can use it, and after that, that ID number will be reflected in your e-card, and then your e-card will be issued to you. So that is the steps and procedure on how e-cards can be given.
Okay, thank you. So Imli, like Kezo has said, there are a lot of procedures to attending this e-card. So when you attend this e-card, will there be any charges for printing or attending to get this e-card?
Yes, a minimal charge of 40 rupees, including taxes, is charged per card printed.
Thank you. So we see that there is only a charge of rupees 40 to attend this e-card, which goes a lot of procedure. That is a very, very minimum charge. And then, Kezo, I want to ask you, does the beneficiary, if you're a beneficiary under the scheme,
right,
can you also, do you have to give money to the hospital to avail the scheme again?
No. So, see, there's a general misconception regarding this scheme, even from the side of the hospital and plus also from the patients coming under this scheme. So, the scheme does not anywhere say that cash amount will be given. It only says facilities and services up to an amount of rupees 5 lakhs. So, for example, I am a beneficiary under this scheme and I have gone for treatment, and in the unpaneled private or public hospital, whichever, and the entire cost of my treatment comes up to say 2.5 lakhs. The scheme has provision for 5 lakhs rupees. So I cannot, as a matter of right, even say that, okay, my treatment is only up to 2.5 lakhs. Now you have to give me the remaining 2.5 lakhs in cash. We don't have any such kind of provision under this scheme. But if your sickness cost treatment is coming up to 5 lakhs, that will be incurred by the state government and will be incurred by the hospital. The patients need not pay any money, but in return we also do not get any money back as in the form of reimbursement, since my treatment was only up to 2.5 lakhs. So there's no provision for cash entitlements or cash benefits under this. It's only in terms of facility and services up to an amount of 5 lakhs that the scheme has provision for.
Okay, so let us say that I am a beneficiary of this scheme, but then I go to a hospital and then I am denied the benefits availed by this scheme. So if in case of such denial, is there, can I file a complaint, or is there a place where I can file a complaint?
Definitely you can file a complaint. So under the scheme, if any hospital denies you treatment, despite you being a verified existing beneficiary under the scheme, or in case where outpatient departments, they deny certain medicines, or they charge you medicines which as per the scheme is supposed to be free, or certain times, worse comes worse, certain hospital could also retain the ID cards of the patients. So in such cases or in such scenarios of incidences, if at all it occurs, then you can file a complaint. But this complaint can be filed in at two forums. One is at the district level, you have the district nodal grievance redressal system, and then at the state level you have the state grievance nodal officer, who will hand over all the complaints and grievances that is being filed. Another thing to address is the complaint can be filed in the form of an SMS or through a text or through email. Also you can address it, but provided we have the contact numbers of the concerned officers at the state and both at the district level. But if at the state and district level also you are unable to address your grievances or your complaint, then at the National Health Authority website itself also you can lodge a written complaint. I will just read out the website address so that the viewers and listeners can also note it down if they want to, and if at all any such kind of complaint arises and they want to address it, they can put forward. I'll just read it out the ID. It goes cgrms.pmjay.gov.in. All these are in small letters. You can this is the portal for the National Health Authority website where complaint and grievances can be addressed.
Thank you so much, Kezo. We have discussed a lot about the scheme and we have come to know a lot about the scheme. and then I'm sure the viewers have also learned a lot about the scheme. But in case there are some people who want to know more, dig deeper into the scheme, is there a number we can call or someone we can contact? Can you please let us know, Imli?
Yes, there is. I'll just read out the number. It's 7628 813737.
Thank you so much for joining us today. Thank you for being here, Kezosano and then Imli. It has been a very insightful and productive discussion, and I hope through this discussion there will be people who will come up to avail the benefits that the government has so freely given. Thank you so much for joining us.